What is selective mutism?
Selective mutism is a childhood anxiety disorder where kids are talking completely normally in their own homes, around their siblings, around their parents, fabulous chatterboxes, often the life of the party. But as soon as they go out the threshold of the door, could absolutely clam up and not talk at all. They can go to school and literally not be heard from for an entire year. Not to their teachers, not to their peers, not on the playground, not in the diner, not in their religious setting, not in their gymboree. Go back in the home, talking like fabulous chatterboxes again. They're social, they're usually of normal intelligence, they're usually have perfectly fine language abilities, but have difficulty verbally expressing themselves.
How common is selective mutism?
It's a good question. The best estimates we have are about 1 in 140 young kids, so between ages 4 and 7. And that would be about 1 in every 3 classes in a typical elementary school.
So relative to disruptive disorders like attention deficit hyperactivity disorder, this is a relatively rare disorder compared to ADHD.
Right. ADHD, probably about 1 in 20 kids. This about 1 in 140. And the difficulty is for therapists who care about helping kids, both psychiatrists and psychologists and others, you don't get much training in it. So we go out of our way to make these trainings available to others and get the information out about how to effectively help kids with selective mutism.
What are the best treatment options that we have for these very young children who are somewhere, let's say, between 4 and 8 years of age, who suffer from selective mutism?
Great question. I just literally got off the phone with a parent who happens to be a physician in California. And she said, am I doing enough for my kid? I said, we work really hard to make sure kids don't get undertreated. So for a typical 4 to 7-year-old that we work with SM, we start out with behavior therapy. But we know at this point, 3 sessions into it, your kid should be talking to me in a room without you there. I know 6 sessions into it, they should be talking with me in school with or without the teacher in the room. If they're not hitting these benchmarks, then we strongly encourage the parents to consider adding medication to the mix. We've never ever had a parent come back to us and say, how could you possibly have told us to do this? So when parents make that move, they do find it helpful.
Tell me about the Brave Buddies treatment program.
Brave Buddies was an invention of ours when we thought about the fact that kids have selective mutism in school settings. And we thought about the fact that treatment as usual, or your grandmother's psychotherapy of 4 walls, was sort of outdated, and it didn't match the circumstance. So we thought, how can we create a situation where kids get to practice being in school for an entire week? So Brave Buddies is an analog classroom, pretend classroom, and every kid every day gets to practice circle time, show and tell, ordering ice cream, trading in their points for prizes at a store. So it's this fabulously concentrated practice session for kids. And we chose Brave Buddies for the meaning of both being brave and having a buddy in your counselor who will help you do it, and the buddies that you develop in the program itself.
What kind of treatment results do we get from kids who participate in the 5-day Brave Buddies program?
So the kids who participate are uniformly increasing their spontaneous speech. They're all increasing in terms of how they respond to counselor prompts. They go back to their homes and by and large are extending those gains to diners, to school settings, to playgrounds, especially if the parents continue to use the techniques that we've taught them, that we modeled for them. And the beauty of the program is that the parents can watch us in the trenches with their kids doing these public outings. So we're seeing really good results long term.
How do you follow up with kids who come from a different part of the United States and participate in the Brave Buddies program?
Follow-up is key, and again, one of the good uses of the internet is that Skype and iChat are readily available tools. So we can do video calls with the parents, we can do video calls with the teachers, as I did earlier today across the country, and we do video calls with the kids themselves and practice continued brave talking. So I had a boy go with a laptop to an ice cream store in Dubai, and we practiced public speaking, me in New York and him in Dubai. It's just a beautiful thing.